In this video, we are going to teach you how to treat epithelial ingrowth following LASIK. This is a case in which, following 17 years after a LASIK procedure, the patient suffered a trauma and flap dislocation happened. After two flap relevations and cleaning, the patient ended in this type of epithelial ingrowth that affected 2 quadrants of the interface and was creating a severe distortion in the topography with important loss of excoriated visual acuity. In these cases, you need to elevate the flap, you need to clean the surface, you need to hydrate the surface with distilled water, and finally you have to suture the flap in order to avoid recurrences and relapses of this epithelial ingrowth. You see here how we have elevated the flap, and when doing that, we realize that there is a melting in one area of the flap that was affected by the epithelial ingrowth. It is important to remember that epithelial cells, especially in those areas in which mucin is produced by the globed cells that are included in this epithelial ingrowth, might happen to be creating a disruption in the flap. This is one of the ways in which epithelial ingrowth can be kept following relevation. As far as this creates a hole in the flap. Once that the flap is relevated with a lot of care, then with a crescent knife we are cleaning the surface by simply taking away the material that you see in the interface. You see here how this material, which is composed by cells and mucin, is being eliminated, and is carefully done both in the stromal side and later on, as you would see, in the flap in stromal side as well. The scratching that we perform with a crescent knife is extensive but not traumatic. We don't want to create any type of scarring in the interface, but has to be strong and vigorous in order to eliminate this foreign material. Following this, you need to use distilled water, that means deionized water, in order to create an osmotic stress in these cells, making them to explode, and also to take away the fibronectin, that is the way in which the growth is created, a kind of pathway to bring the cells into the interface again. Here you see how we are carefully cleaning the stromal surface of the flap as well as we did with the stromal side. Sponges are used in order to eliminate the material. And you will see now how we are irrigating the surface, both surfaces, with distilled water. Remember, distilled water has to be used because of the osmotic stress that is creating on the epithelial cells, and also allows not only the detachment of the cells, but to eliminate the fibronectin pathway, that is the way in which the cells have a scaffold to invade the interface again. Once that hypotonic water has been used, then we can clean the interface. We replace the corneal flap with a spatula. We see here where the disruption of the flap is happening because of the melting, and now with 8 arcing marks we are ready to suture the flap in 7 meridians. These stitches are placed in the most symmetrical way possible in order to create the less stress in the flap, as stigmatism is going to be induced while these sutures are in place. The suture will be left for about 10 days, and during all this time the patient should wear a contact lens as far as the knots will not be buried, in order to avoid further trauma and further ways for the epithelial cells to grow into the interface. Tenor nylon is used for the purpose. Symmetrical stitches in the same meridian are used every time in order to create symmetrical tractions from the flap and symmetrical attachment to the flap to the corneal stroma. The area with melting and the hole that has happened in the flap will be left alone, as far as there is no way to cover this disruption, and indeed this will be distorted by the stitches, but there is no other way to close this epithelial ingrowth. As far as if you don't use the stitches, 100% probabilities happen to have epithelial re-ingrowth, as it happens always in these severe cases. As you see, the knots are not buried inside the stroma, but rather left outside, which obviously needs to be covered with a contact lens. Thank you very much for your kind attention.